Welcome to the ImmunoVerse, a podcast that brings the ever-expanding universe of immunotherapy to life through the voices of those advancing this groundbreaking field. I'm Dr. Patrick Hu, President and CEO of Moffitt Cancer Center and a career immunologist. In each episode, I sit down with pioneering experts who have shaped the past, present, and future of immunotherapy, uncovering breakthroughs, challenges, and the science driving this life-saving innovation. Today, we have with us Dr. Jim Mulé, Associate Center Director of Translational Science here at Moffitt. Dr. Mulé is a world-renowned immunotherapy expert, recognized for his research and clinical trial contributions to cancer immunotherapy, particularly in solid tumors. His clinical research group at Moffitt is involved in developing and validating genomic signatures of immunotherapy response, as well as vaccine strategies and other approaches to recognize and destroy tumors, including cell-based therapies. He has published over 200 articles and has been an NCI-NIH investigator continuously for nearly 30 years. Welcome to the ImmunoVerse, Dr. Mulé.
Thank you, Dr. Hu.
Well, tell us, you've really been in this field for a long time of immunotherapy. Tell us about the early days. People really didn't think we could trigger the immune system against cancer, did we?
No, it's very true. I mean, we were sort of the outsiders of the investigative field. Prior to that time, much of the focus had been on chemotherapy drugs, radiation therapy, and to some extent also surgery as the three frontline treatments. And when we started to look at the impact the immune system might have on tumors, it was not only in its infancy, but also there were many skeptics out there. So even if you were successful in the laboratory, developing new concepts and having new discoveries, it was very difficult to get those papers published because of skepticism out there.
Yeah, so tell me, what made you interested in immunotherapy, and what told you that this was going to work one day?
I was a graduate student. I left New Jersey to go to Seattle for graduate school at the Fred Hutchinson Cancer Center when they first opened their doors in Seattle, and met a young Swedish couple, Karl-Erik and Ingrid Hellström, who came from the Karolinska Institute in Stockholm. And they were the ones who were pushing, at that time, the need to establish a tumor immunology program at the Hutch. And I was one of the first graduate students.
Great. And then shortly after that, you started working with Steve Rosenberg at the National Cancer Institute. Tell us what took you over to the NCI.
So after I finished my time in Seattle, it was time to move on for a postdoc after I got my PhD degree. And it was slim pickings at the time. There were not a lot of options for laboratories who were really at the forefront of studying tumor immunology. And it was Steve's lab that was first on the radar screen, and the Hellströms encouraged me to apply, which I did, and I was accepted.
Great. And how long were you there with him at the National Cancer Institute?
So I worked up the ranks, initially as a postdoc, then a senior fellow, and then tenured senior investigator over the span of 10 years.
Great. And that's where we met, because you were one of my mentors there when I worked with Steve Rosenberg.
Exactly right, yeah. I likened it to our team, including you, Dr. Hu, and a number of others in the lab, to the 1927 Yankees, that it was arguably one of the best baseball teams in history. And I thought that we very much were that type of team.
So when you think about what went on there in the 80s and the 90s, a lot of revolutionary things that are still being done today, like T-cell therapy. So tell us about the initial T-cell therapies.
So originally, much of the work was in mouse because you had to show impact of whatever treatment you had in preclinical animal studies before you could go to the FDA to run early-stage clinical trials. And at that time, interleukin-2, or TCGF, was first identified and cloned. That Steve took that and showed that you could expand T cells outside the body using IL-2. And that set the whole stage for us to not only study the biology of T cells, but use them therapeutically.
And so, some of the first that were done there at the National Cancer Institute in our group with Steve Rosenberg were really gene modified cells, right? No one thought that you could do gene therapy in people, but that was where we really started putting CAR T into T cells, TCR-T into T cells. I remember that. I think that was your idea. Said, why can't we just put T cell receptors into T cells? And that way you work with Mike Nishimura and others. And that was really the first demonstrations that you could put T cell receptors into T cells.
Yeah, it was that, but also you could insert cytokine genes into T cells. And so there was a separate effort going on looking at what genes could be put in T cells that would not only help their biology, but strengthen their potency. And, you, of course, was one of the pioneers in developing CAR T, if not the pioneer with Steve, and show that you could not only do it in mouse, but you could do it in human. And this was also true with Mike Nishimura, with you, and others in the lab, that you could also do this with TCRs and endow those T cells to recognize tumor.
So I think, it's exciting because these new trials now, CAR Ts have been approved for blood cancers, and now we're going into solid tumors. The TCR transduced T cells are now getting nice responses in some patients with solid tumors.
Very
and
true.
I think people don't realize it started so long ago, back in the 90s at the National Cancer Institute.
It's very true. Very true. It's come a long way. And as you point out, the therapeutic effects that one is now seeing in the clinic speaks volumes to the courage we all had to keep going and to develop these technologies and get them into patients and show benefit. There was an army of skeptics at that time that would push back at us in every way, either through publications, talks that we would give. And so if there was anything I learned in my career was you never give up, you never look back, and you just keep going. And that's how you become successful.
And when people tell you, hey, that's not going to work, if you have good scientific basis that it's going to work, keep going.
Exactly right. Exactly right.
So let's talk about tumor-infiltrating lymphocytes. Those were discovered at the NCI in the Rosenberg group while you were there, and actually the name tumor-infiltrating lymphocytes was coined there, right?
Correct.
And so tell us about the first TIL studies.
Well, again, it was started in mouse with René Lafreniere, who was a clinical fellow in the lab with us. And with Steve and a few others had that paper in Science, which was the first to show, at least in the mouse, you could isolate, grow these T cells and show they were therapeutic and cause dramatic tumor regression in mice. And then we were off to the races. And the next step was to show you could expand human cells and give them to patients.
And so that now is FDA approved. So how does that make you feel, that things that you helped start way back in the 80s, 90s at the National Cancer Institute, now FDA approved?
It's very rewarding. It's very rewarding. I mean, when I came to Moffitt, there was no question they were going to support this and bring it here to Moffitt. And we were able to then take this out of the NCI and show that we could treat patients here at Moffitt.
Yeah, so let's talk about that a little bit. So after the NCI, you went to industry for a little bit. Then you went to University of Michigan. Then you got a phone call in the early 2000s. Tell us about Senator Connie Mack, and why did he get interested in TIL, and how did that come where he was calling you, recruiting you from the University of Michigan?
Well, they called me. I got a call. It was in the morning of April 2nd or 3rd in Ann Arbor. I was in my office, and there was 30 inches of snow on the ground, and it was a complete whiteout. And I was asked to come, to consider coming to Moffitt for an opportunity. And jokingly, half jokingly, I said, "I'll be on the first plane as soon as the airport opens." So I arrived, and Lee Moffitt, Connie Mack were very instrumental in convincing me that this was the place I should come to, and it was a very easy decision.
So Senator Connie Mack, and we've talked to him about it. He helped to double the NIH budget
Correct.
when he was a senator. He went into a bookstore, saw Steve Rosenberg's book, The Transformed Cell, got really interested in T-cell therapy.
That's right.
Called Steve, said, we want to do this. He was the board chair. Connie Mack was the board chair for a while at Moffitt, and he said, we should do T-cell therapy. So we
Correct.
called Steve and said, who do I need to hire? And he said, hire Jim Mulé.
Yeah.
And that's why they called you, and why in 2003, when you came to Moffitt Cancer Center, you really started from scratch.
Exactly.
The T-cell program. And we were one of the first places outside of the National Cancer Institute offering T-cell therapies like TIL therapy. But you really started from scratch here, right?
Exactly.
And there's a huge commitment to it. But back then, people might have thought, really, at Moffitt Cancer, you're going to invest in that? Right? 2003, it wasn't a common thing, right?
It's very true. We tried at University of Michigan, and there were just too many hurdles to get it off the ground in Ann Arbor. And here, it was a welcome relief to have such support to get this going.
Back in 2003, it was really quite a risk to go and hire someone and build a T-cell therapy unit. So what went into that? There's nothing here for T-cell therapy. What did you have to do to get T-cell therapy to make Moffitt now one of the world leaders in T-cell therapy? Tell us about that journey.
Well, it didn't hurt that the board chairman was behind this with Connie Mack. A melanoma survivor. In fact, all his siblings developed melanoma in the family. So he was committed. And Michael McGillicuddy, I hold the family's endowed chair at Moffitt, was in honor of his brother Michael, who passed away from melanoma. And it was through his interaction with Don Adam, who became a benefactor of this initiative and gave the largest gift to Moffitt at that time to allow us to set up a special facility under FDA guidelines to be able to grow TIL, expand them, and give them in clinical trials. It was that gift that really launched the effort.
It was really a lab that, is still going strong today, a clinical lab to grow T cells for patients.
Correct. And, again, there were skeptics even at that time, not within Moffitt walls, but still, can you really take this out of the NCI? And because at that time you had MD Anderson, and it was you and your group with Moffitt that we were able to launch TIL outside the NCI. And those data actually was able to convince, to some extent, the FDA to go forward and get the approval.
Right, there's a lot of hurdles. When I tried to start this at MD Anderson, we did successfully.
Yes.
There was a lot of hurdles, a lot of hoops to jump, because people were like, what? They're used to taking a drug off a shelf to treat cancer patients.
Correct.
But with TIL, you have to take the tumor, isolate the immune cells from the tumor, from the OR, right to the lab, grow the cells to 100 billion or so, and then give them back. And it's a lot to do that.
Correct.
At that time, those are the only three places, the National Cancer Institute, Moffitt, and MD Anderson,
Exactly right.
where you and I were, that could get.
Right.
People could get TIL therapy, right?
Absolutely.
Now, so tell us, last February, a year ago, TIL therapy was approved by the Food and Drug Administration for advanced melanoma. Right. Tell us about that and what that meant to you.
Well, it was, some would say, well, it's the end of the journey, but really now it's the beginning of the journey, because we have a lot we can do now that it's an approved therapy by the FDA. And so it was very rewarding. When you look through the years, you look through all the hassles and combine it with the successes and the path you took, the decisions you made along the way, that to see that approval was incredibly rewarding.
And tell us, what's the future of TIL therapy? It's right now approved for advanced melanoma. Is it going to work in other diseases?
Well, I'm a believer, as I believe you are, and we're seeing responses in non-small cell lung cancer at Moffitt, and also studies that are being conducted by Iovance. Most recently, we're seeing complete responses in bladder cancer with the installation of TIL in non-muscle invasive bladder cancer, which is very encouraging. And so the technology has gotten to a point where we're more confident and comfortable that we can take this beyond melanoma.
Great. And then, you've pioneered a lot of things. Another area that you've really pioneered is this area of tertiary lymphoid structures. Tell us about what is a TLS?
So a TLS is a microscopic lymph node, and they're found embedded and surrounding solid tumors. Not all solid tumors, but they, by all intents and purposes, under the microscope, they have a similar composition of peripheral lymph nodes in the body. And we found them back 14 years ago, that we identified these structures, very unique, and we're the first to show that it correlated with clinical response to immunotherapy. Tumors that were absent, were negative for these TLSs, inevitably those patients did poorly and showed little, if any, response to immunotherapy. So we believed at the time there was a connection between tumors having no structures and the body responding inside the tumor mass to cause immunotherapy to be effective. We sent the paper to top-tier journals, and I saved the critiques from the reviewers, and we could not get the paper published. There were so many non-believers because we were told, why hadn't pathologists identified these before? Well, no one ever asked them to look for them, by the way. But so we had a hard time getting that paper published. Finally, we did. We followed it. That was in colon cancer. We followed it up. Same story, same true outcome. In melanoma, again, had trouble publishing that paper. Fast forward today, 14 years later, there are hundreds of thousands of papers now identifying these structures and showing clinical relevance.
So it just shows a lot of times when you're first, there's an uphill battle.
Exactly.
And these TLSs are going to be important, not only to understand who's going to respond and who's not, but maybe to find the kinds of cells that we need to help mediate response.
Exactly right. Exactly right. We now have new data to suggest that tumors that have those structures generate better TIL.
Now, so we've come a long way, and the future looks bright for immunotherapy. And we have a colleague, one of your very good friends, who recently passed from pancreatic cancer, Jeff Weber. He was attending here, a researcher here. He saved many lives when he worked at Moffitt Cancer Center. Recently, he passed away from pancreatic cancer, and I know you're a very good friend of his. Tell us how that hit you, and what does that tell you about what we have to continue doing?
Well, Jeff was with us at the NCI with Steve, and he was in the lab with us. Very, very true to the immunotherapy field. Same phenotype, same genotype. Wants to show that immunotherapy is highly effective in solid tumors. He was here at Moffitt. He established the Adam Center of Excellence for melanoma when he was here. Also was able to get the first spore, NCI spore in melanoma. And then he became deputy director at NYU Cancer Center at the Perlmutter. I can remember one day he called me and he said, I had a colonoscopy and I had some undefined pain. So I said, could you also do an ultrasound? He said, well, the good news, they came in and said, your colonoscopy showed you're clear. The bad news is we found a mass on your pancreas, and he fought the battle. He was so true to his field, to his work. He worked up until a Friday and passed away on that Sunday. He never gave up hope. He kept working, seeing patients, taking care of his patients, and he was not able to beat the disease.
I know you even went up and helped his spouse clean out his office there at NYU. And what was going through your head as you were cleaning out Jeff's office?
Well, I would go up there to help the family when he was sick. And so I would go up probably every 3 weeks up to New York and had a final dinner at their house in Manhattan. And it was heart-wrenching.
So one of our own dies of pancreatic cancer. So far, we haven't gotten immunotherapy to work in pancreatic cancer.
Right.
Are we going to get immunotherapy to work in pancreatic cancer, Jim?
I believe we will. I think we have to engineer. I think we have to engineer the immune system in different ways. We have the tools. I think it's known to be, not seen by the immune system, and hence immunotherapy is not effective. But I really do believe with the new tools we have, we'll be able to make an impact.
Jim, want to wrap up, want to thank you for joining us today.
Pleasure.
You're such an expert in immunotherapy. You've really helped the genesis of this whole field. We've come a long way, saved a lot of lives. But as we reflect on Jeff Weber and his passing from pancreatic cancer, just shows us how much more we have to do.
Exactly
but
right.
Very optimistic that we're going to get on top of all of these cancers.
Very much so.
Immunotherapy and T-cell therapy. So thanks for going on this journey with us through the ever-expanding universe of immunotherapy. To hear more episodes of the ImmunoVerse, subscribe on your favorite podcast platforms.